This episode is adapted from a clinician-written article on Mentalyc and brought to life in audio for therapists who prefer listening on the go.
Exactly. We know how busy everyone is, so hopefully this makes it a little easier to digest these important topics.
Right. This particular piece was written by Gargi Singh, a psychologist, and we're just really excited to feature their perspective here.
Her insights are fantastic. And since the article comes from Mentalyc, it probably helps to know it's a platform designed to make clinical documentation more manageable for therapists.
Which feels very relevant to today's conversation. You know, it really got me thinking about those moments in a session, that feeling you get when you've said something and you can just feel the air change.
Oh, I know that feeling. It's like a subtle shift, right? The client might still be nodding, but their eyes have gone somewhere else. The connection just thins out for a second.
Exactly. And you're replaying your last sentence in your head thinking, what was it? What did I miss? So often it comes back to this idea of cultural competence, or maybe more accurately, a moment where my cultural humility fell short.
Yes, humility, that's the word. I think for a long time the focus was on competence, as if it were a textbook you could just memorize. Learn these 5 facts about this culture and you're competent.
Right, as if culture is a monolith. And it's not just about knowing facts, though, of course, that context is helpful. It's about recognizing that our own cultural lens, our own baggage, shapes everything we see and do in that room.
It shapes the questions we ask and the ones we don't ask. I remember early in my career, I had a client whose family was deeply involved in all his major life decisions. In my very Western, individualistic training was screaming, enmeshment, lack of differentiation.
I can see that. The classic textbook response.
Totally. And I started gently probing around that, and he just got quieter. It wasn't until much later that I understood that for his culture, that collective decision-making wasn't a sign of pathology. It was a sign of strength, of community, of love. I was trying to fix something that wasn't broken.
That's such a powerful example. It's that moment of realizing our diagnostic framework, the very lens we use to understand distress, is itself a cultural artifact.
It is. And that's where the humility comes in. It's the shift from, I am the expert on psychology, to, you are the expert on your life, and my job is to be curious. When we can genuinely own up to our limitations, that's when the real therapeutic magic can actually happen.
It's about creating a space where the client feels safe enough to be our teacher in that moment. To say, actually, in my family, it works like this, without fearing judgment or pathologizing.
And that brings up such a critical point about documentation, right? How do we capture this stuff? Because if I had just written in my note, client is from X culture, what does that even mean? It's a stereotype waiting to happen.
It's worse than unhelpful, it's potentially harmful. It flattens the person into a single label. The key is documenting what is clinically relevant. So instead of that generic label, it's something more like, client expressed that his family's value of collective decision-making is a source of support, and he feels pressured to align with my therapeutic goal of increased independence.
Boom. There it is. Now that is a useful note. It shows the cultural factor, it shows the clinical tension, and it honors the client's experience without judgment. It's a roadmap for the next session.
And it protects us from our own biases. Because if you just write, client is Hispanic, the next clinician who reads that note, or even you 6 months later, might fill in that blank with all sorts of unconscious assumptions.
100%. We all carry implicit biases. It's not a moral failing, it's a brain thing. The work isn't to pretend we don't have them. The work is to face them, get curious about them, and build systems, like better note-taking, to mitigate their harm.
It's so true. And the stakes are incredibly high. I mean, think back to that unequal treatment report from the Institute of Medicine way back in 2002. It was a bombshell.
Oh, yeah, it laid it all bare. Minority clients were getting worse health care across the board, even when you controlled for things like insurance and income.
Even when the money wasn't a factor. And the report pointed the finger directly at provider bias, stereotyping, and prejudice. That's not an easy pill to swallow for those of us in a helping profession.
It's not. It's deeply uncomfortable. But we have to sit with that discomfort. Because those statistics are not just numbers. They represent real people. People who are more likely to be misdiagnosed, more likely to drop out of treatment, and less likely to get the healing they deserve.
And when you layer on the other barriers, language, the stigma around mental health that exists in so many cultures, the historical trauma with medical systems, it's a perfect storm of inequality.
It really is. And when a therapist lacks that cultural awareness, they can do so much unintentional harm. They might miss a cultural expression of distress entirely. For example, a client who expresses somatic symptoms because direct emotional expression is discouraged in their culture might be misdiagnosed with a somatic disorder, when really it's just a different language for depression or anxiety.
Or they might dismiss cultural strengths that could be incredible resources in treatment. Things like faith, community rituals, or reliance on elders. We're trained to look for deficits, but sometimes the most powerful medicine is already present in the client's cultural toolkit.
Yes, and we just need to be curious enough to ask about it. On the flip side, when clients do feel seen, when they feel genuinely understood and respected in their cultural context, everything changes.
The whole dynamic shifts. They stick with treatment longer, they're more open. The therapeutic alliance, that bedrock of everything we do, becomes so much stronger.
It's the difference between someone just showing up and someone truly engaging, and that's where the real work gets done.
Quick pause. If this part of the work feels familiar, especially the challenge of capturing these nuanced cultural details in your notes, Mentalyc can help. Its AI note-taker is designed to help you document the clinically relevant specifics, supporting your judgment while staying fully HIPAA and SOC2 compliant. You can explore it at Mentalyc.com.
That's such a needed tool because getting that documentation right is part of the ethical practice here. Thinking about what happens when we miss the cultural boat, it can be so insidious.
Insidious is a good word for it, because it's often not a big, dramatic rupture. It's that client who smiles and nods through the whole session while internally planning their exit strategy.
Oh, I've had that client. And you feel like you're having a great session. You're making all these brilliant connections, and then you get the cancellation email. And you're left wondering what on earth happened.
And what happened is that they felt misunderstood or judged or just dismissed. They might have presented a version of themselves they thought would be more acceptable to you, the therapist. And that just kills the authenticity that therapy absolutely requires to work.
It totally does. And misdiagnosis becomes so much more likely. What we might label as resistance could actually be a cultural norm around deference to authority. What we see as a lack of insight might be a completely different but equally valid way of understanding mental health.
Right. A client might view their symptoms through a spiritual or communal lens, not a psychological one. And if we ignore that perspective, or worse, try to correct it, we've completely derailed the process before it even starts. We're not speaking the same language anymore, even if we're using the same words.
And the therapeutic alliance just takes a nosedive. The client holds back, they minimize their symptoms, or they just stop showing up. And then we end up treating this surface-level version of the person instead of getting to the real, raw, messy stuff where the healing is.
And at its worst, we can actually reinforce the very systems of oppression that contributed to their mental health struggles in the first place. By subtly communicating that their way of being is wrong or unhealthy, we become another voice of invalidation in a world that's already full of them.
That's the deepest fear, isn't it? That in our effort to help, we are inadvertently causing more harm. It's why this conversation is so vital. It's not an add-on. It's not a special topic. It is central to ethical, effective therapy.
It is, and I think breaking it down helps. This idea of separating cultural knowledge from cultural awareness, and especially from cultural humility. They all work together.
Exactly. Knowledge is the what, the facts, the history, the context. Awareness is the me, understanding my own biases, my own culture, my own worldview. But humility is the you. It's the posture of putting the client's experience at the center and staying open and curious.
I love that framing. Humility is what keeps you from becoming the expert. It acknowledges that you will never know everything about every culture. It's impossible. But you can stay open to learning from every single person who walks through your door.
It keeps you asking questions instead of making assumptions. And that's what builds the relationship. That's what strengthens the alliance. That's why tools that help you reflect on the alliance are so interesting. You know, like Mentalyc's Alliance Genie. The idea isn't to have a machine tell you what to do, but to give you data points for your own reflection.
Right. It can surface those subtle shifts we talked about earlier. Maybe it picks up on a change in pacing or tone after you asked a certain question. It's not giving you the answer, but it's pointing you toward a question you need to ask yourself. What happened in the alliance right there? Could a cultural blind spot have played a role?
And that self-reflection is the engine of growth here. It needs to be a regular part of our clinical practice. Just like we do case consultations or read up on new modalities, we need to be regularly reflecting on cultural issues. It's not a one-and-done workshop.
It's a lifelong practice, a commitment. And our society is only getting more diverse. The demand for culturally competent and culturally humble mental health services is just going to keep increasing.
Which means the therapists who are doing this work, who are developing these skills, they're not only going to be better positioned to serve their communities effectively, they're going to be actively contributing to a more equitable healthcare system.
That's the bigger picture, isn't it? This isn't just about being politically correct or checking a box on a form. It's about providing the absolute best possible care to every single person who has the courage to ask for help.
Yeah. It's about honoring their courage by showing up with our own. The courage to be humble. The courage to admit we don't know. The courage to say, tell me more. I want to understand.
That's it right there. That's the heart of it. So if there's one practical takeaway from all of this for the clinicians listening, what would it be?
I think it's something small and actionable. Maybe this week, in one session, try asking a question you haven't asked before. Something as simple as, is there anything about your background, your culture, or your beliefs that you feel is important for me to understand as we do this work together?
I love that. It's so open, it's not leading, it's just an invitation.
It's an invitation, and it positions the client as the expert. You might get a simple no, not really, or you might get an answer that completely reframes the entire therapeutic process. But you won't know unless you ask.
That's a beautiful, simple, and profound practice to adopt. It really all comes back to combining that cultural knowledge with genuine humility. That's how we create these effective, respectful, and truly healing environments.
Couldn't have said it better myself. It's good for our clients. And honestly, it makes us better, more effective, and more connected therapists. It's better for everyone.
Absolutely. And if you want support reflecting on those subtle alliance patterns across your sessions, especially where culture might be playing a role, a tool like Alliance Genie can help you notice those moments without ever storing session recordings.